Hello, internets, interwebs, other ways of accessing information. Um, that was an odd intro. Welcome to the Larval Onco Data Podcast here on our usual Friday. And speaking of usual, I couldn't help but bring in one of my usual guests, Darko, today I guess the premise is to dive a little bit deeper. We're really excited about leveraging LARVOL CLIN's outcome data, KM curves, hazard ratios, all the types of extracted outcomes data that we have into network meta-analysis. I guess just recently, Darko joined me, but I felt like we gave network meta-analysis short shrift, maybe 2 or 3 minutes, which is vastly inferior amount of time to speak to it. So I invited Darko back to talk to that new element of our CLIN software that he's been a leader in helping us build. So, although I don't know if you need an introduction anymore, Darko, I believe this is your 800th appearance on my podcast, but maybe if you could give your quick intro and we could dive in. So, welcome again, Darko.
Thank you so much, Mark. As always, it's so great to be your guest at the podcast. And as you said, I'll just do a very quick intro as I'm a very, very regular guest at your podcast. So, my name is Darko Medin. I'm a biostatistician and someone who also works with various research companies, institutions in the field of digital products, artificial intelligence, and so on. And I like to say for myself, I'm a big friend of Larval, and I also have a lot of projects that I collaborate with the fantastic Larval team. So again, really great to be here and looking forward to exploring one of the products that we built in the past few months with Judith Perez and the rest of the team. So kudos to the entire team, to Judith, and thanks again for having me here, Mark.
Of course, always my um, pleasure have you as a friend and as a member of the team. And that was a nice shout out to Judith, who I think had a podcast last week, and I think I had 4 or 5 or 10 calls with her today. So we're all working very hard on building these sort of, I'll say, if it's okay to say, more sophisticated elements of the CLIN software and building that out. And I guess what I'd like to set up is sort of twofold is, we're really interested in CLIN just as a principle of the platform is being able to do benchmarking for our pharma clients. So there's there's various and sundry different ways of doing that, working from sort of a base level comparison and seeing what thresholds you need to hit to any new interventions, whether it's a brand new drug or it's a combination of previous existing therapies, and what benchmarks do you need to hit relative to changing standard of care, being practice impacting, or in the best case scenario, maybe for a pharma company being practice changing. And I guess that's the big, sort of backup setup that I wanted to say before we dive in. And I guess my other setup is we'd really like to dive. There's a number of elements here that I don't think we've been able to address and show on the podcast. So I set Darko up earlier today. We chatted briefly before sitting down for the podcast, and I set him up for a bit of high pressure. And I said, how would you describe this to me as if I were a 12-year-old? And so that's a challenge I gave as a quick note this morning. And he's sharing his screen right now. And we just like to dive into the elements of network meta-analysis, NMA, and CLIN. And that was a lot of exposition for my setup. So maybe I'll yield over to you, Darko, and we just want to dive through in the 10 minutes or so we have left in today's podcast. So fire away, Darko.
Okay, thank you so much, Mark, for a fantastic intro into what we will be discussing more today. we discussed this a little bit in one of the previous podcasts, which is the network meta-analysis module, which can be seen here at the top right part of the screen. So that module allows to combine a large database that exists on LARVOL, one of the largest databases out there for oncology randomized controlled trials, to connect that with the network meta-analysis ability to actually compare a larger number of treatments, different treatments. So in comparison with the typical network meta-analysis, where we usually have one treatment which is compared across multiple trials and compared to some control, with network meta-analysis, we can make a very large number of treatment comparisons. They can be different treatments, so they don't have to belong to the same treatment category, and we can compare them to each other. So that's one feature. The other feature is that we can infer indirect evidence, which also we cannot do in the standard meta-analysis. So I'm going to now walk the audience through one example. Now, usually it takes some time, even though this module is meant to speed up the network meta-analysis. So network meta-analysis usually takes months and months to perform without specific software such as NMA module. With NMA module, it's much faster, but it's still a complex analysis. And we prepared, just to be very time, we prepared one example to guide the audience through different modules and tabs that we have there. So
Sure.
as you can see in this screen, the user has an option to select different types of disease. For example, a non-small cell lung cancer. And this is the example that we'll be showing today. And the platform will find all the trials for that specific disease that are applicable. So we can see here that we have 490 trials. So that's a large number of trials. From those trials, we have the option to choose endpoints. We have the option to choose different treatments, controls, and so on. So I will skip this process, which would be done by the user of the NMA module. And finally, I will now switch to the example that would be a product of selecting type of disease, selecting different endpoints, different treatments, controls, and so on. So I'm now sharing a different tab, and the audience can now see an example of how NMA would look when it's initiated. So the first tab is the data preview, where the user has the ability to see the trial name, regimens, a number of participants, treatments, and so on, to check if everything is okay. Then we have the summary of this. So for example, here we can see total number of patients in the network is more than 7,000. So this already tells us that NMA is usually for large-scale analysis. We can use it on a smaller scale, but the main advantage is when we use it on a larger scale. So we have other summary metrics here, and we can move on to...
Let's go back. I'm going to jump into my challenge of being the 12-year-old in this scenario. So all of this is direct. It's functionally direct data. Number of interventions, number of patients, number of direct comparisons. This is all direct. This is all direct data summary. I say that because with network meta-analysis is about making indirect comparisons. But if somebody's checking out CLIN, I just wanted to call that out and make sure it's not something that we're missing here as we present it. Is that a fair statement?
Yeah, that's a fair statement. So this is a summary of direct evidence, what we start with. And as we'll be seeing later, we can use NMA to add more to this. So we later we'll be having more than what's presented here. And this is exactly as Mark pointed. So this is direct evidence summary, and later we'll see how we can add more information with NMA. So if I may proceed with
let's fire into the fun stuff. I just had to ask the basic question. Let's go.
So to the fun stuff, this is usually what people see and think of when we mention network meta-analysis. It's a network. This is actually that direct evidence that was summarized, but now it's visually more intuitive, right? We can see, okay, we had most patients for erlotinib, right? We have the largest circle here. And then we can see with how many comparisons in those trials were, extracted from the data. And we can also see where the missing data is. So if we don't have the links between these nodes, if we don't have the edges that connect them, those are the comparisons that are just not in the data. They were either not performed or there is some other reason why they are not extracted from the data. Usually it's that they're not performed as studies. Those specific studies don't contain that combination or that comparison. So we can see there are some missing links, but we can use network meta-analysis to help us connect all those dots, find those missing links as indirect evidence. So going forward, we can go to forest plot tab, which actually tells us which of the treatments is performing the best in this network. So treatments that have a lower hazard ratio, that have this box and this interval to the left, they perform better, and vice versa. And what's very important is that NMA module on LARVOL uses a frequentist approach of network meta-analysis. It's very important to understand that these are not just boxes and whiskers and intervals. There is a mathematical approach behind this analysis, and we wanted that mathematical approach to be as accurate and as trustworthy as possible. This is very important in field such as oncology. So we need to use the models and the approaches that are as reliable as possible. Now, just to be wary of time, I'm going to quickly go through some of other tabs. With the net split, we can have any combination of pairwise comparisons in the network. We can check the confidence intervals, which are these lines to the left and right of the boxes, see which treatment is better compared to any other treatment in the network. And very important, we can check consistency. We have direct estimates, as it can be seen here, and we have indirect estimates. So in this case, we can see that direct and indirect estimates, they are sort of consistent. They're very close to each other, and they're on the same side of the reference line, and their intervals, they're not different, they overlap. So we can see, this is called local consistency. We can see here that it's consistent. And finally, we have other tabs such as net meta summary. We have a very important tab, which is NMA matrix. The NMA matrix is actually showing what Mark was mentioning before. This is what we had with direct evidence. So you see there are a lot of missing pieces of information here. There are a lot of nodes that were not connected to each other in the studies that were that were containing these comparisons. But with network meta-analysis, we can now fill all those gaps. And you can see here lower compared to this diagonal, every cell is filled with some information. That information is hazard ratio. So any missing link is now completed with the network meta-analysis. And finally, we have the regimen ranks. We can see which rank performed the best. In this case, it's docetaxel. And we have a whole scale of how treatments were performing, and hope that for the audience, this very, very quick summary of what's happening within NMA model was useful, but I'm going to stop here and look for any additional questions from Mark.
I might just ask one question. I hadn't looked at the gefitinib reference, so I got a little bit distracted by the data. But maybe one way to differentiate, maybe just as one question, if you were to go back up for maybe looking at forest versus net split. So if we go to forest, all of this, I'm trying to differentiate what's direct and versus what's direct and comparing indirect, just as a simple view of what we're seeing here. So maybe in a sentence or two, how would you differentiate what we're seeing here, which is a much smaller forest plot where everything's being compared relative to gefitinib versus what we saw in the net split, which has a direct and indirect? I think that's sort of a key descriptor for anybody looking at these two tabs. And I think we might have lost your screen, but we could do verbal as well. So I just wanted to ask that one question, because I might have 30 more, but like I always say, this is the shortest podcast in the history of podcasts. But how would you describe the differences between those two views of this gefitinib look?
Yeah, so in the forest tab, not sure if it's visible right now, Mark.
It is. Yeah, it's back.
It is.
You're good.
Yeah, so in the forest tab, we have something which is called the network effects. So those network effects are actually combined direct and indirect evidence. And
Yeah.
we can actually see that right here on the net split. So can you confirm if you see the new net split plot?
Yeah, we're good.
Yeah, so for example, here you can see that there is a network estimate. So for our audience, it's a combination of direct and indirect estimates. So these two boxes, when combined, we get a diamond, which is called the network estimate. So that's why this net split plot is much more detailed. It contains information about indirect, direct estimates, and finally the network effects. And what we see in the forest plot is just those network effects for every single treatment that we have in the network. And that's why it looks vertically shorter, because it's sort of a summary of all indirect and direct evidence that we have for those specific treatments.
Well, yeah, and that's great, because I just wanted to differentiate, because if you have CLIN users or people have checked out CLIN, you can use very straightforward forest plots to put, the whiskers together as you see fit. But what this is sort of fundamentally different in that this is a consolidation to where you have all of these as network effects, and then it's blocked out on the net split, more specifically for direct, indirect, and then what the network effect here is. So it's sort of where I hate to call that a summary, that sounds dense to say it that way, versus, having all that split out. And to me, in terms of when I'm, looking at these, not being a biostatistician, I usually jump to the net split, but I just personally don't jump as much to the other panel. So I guess that was my question. Like I said, I asked Darko to go through this with me like I'm 12 years old as an exercise. And I don't know if that was a 12-year-old question or slightly older. Hard to say. So given time, we'll probably have to leave it there. I think there's a lot of things we can present maybe in the future on network meta-analysis. If you follow this podcast or you follow our Building in Public podcast, we've also been presenting on pseudo IPD, which is also a really exciting thing that Darko himself is also involved in. So you might be seeing more of these coming out. Also relative to my podcast, keep an eye out. AACR is right around the corner, so I have to mention that. You'll probably be seeing a lot of things out of our social as AACR is right around the corner. Maybe looking at some of the, especially some of the social media data in CLIN. So I have to conclude with some sort of pitch, but that pitch aside, want to thank, as always, my friend, my colleague Darko, for joining me today, and follow us on social. And if you need a biostatistician, I think Darko might be open to helping you out. So find him on LinkedIn or his social. So thanks as usual, Darko. It's always good to see you, my friend.
Thank you so much, Mark, my friend. It's always a pleasure. It's always great to be your guest at the podcast and catch up. And looking forward, if there is a chance in the future, looking forward to discussing even more interesting topics.
Let's go ahead and pencil it in. I'm sure there will be, but we'll get the exact dates later. Thank you, Darko. Thanks, everybody, for listening.